Corneal staining. When do we see it? What does the staining indicate? How do we grade and record the staining? What degree of staining is clinically significant? Hi, I'm Chris Snyder. Over the next few minutes, I will answer these questions and more about corneal fluorescein staining. My intention is to clear up existing confusion on the issue while reviewing the way we recognize, grade, and evaluate corneal staining in our patients. Fluorescein staining occurs occasionally in virtually everyone, whether they wear contact lenses or not. If there is another person with you right now, it is likely that one of you would show at least a trace amount of corneal staining, indicating nothing more than normal epithelial cell turnover. This subtle staining is best observed through a yellow filter that provides an enhanced view, giving you a better chance of seeing common, low-grade staining. A highly recommended technique. Of course, staining at higher levels than this lower-grade physiologic amount may indicate a disrupted or compromised corneal surface from a variety of challenges such as dry eye, inflammation, infection, or mechanical causes. And the presence of symptoms should not drive your decision to look for staining, since there is very poor correlation between symptoms and the presence of staining. In fact, more than half of symptom-free, daily disposable soft contact lens wearing patients and almost 8 of 10 successful extended wear patients are expected to demonstrate at least some degree of low-level staining. So it is important to look routinely at all patients, even if there are no symptoms. It is interesting that on the occasions that moderate or severe staining is seen with hydrogel lens wearers, 3 primary factors have been associated with such cases: non-compliance with contact lens care systems, regardless of care system brand, conventional yearly lens replacement schedules, and lens powers greater than 3 diopters. The more routinely you check for staining in practice, the better appreciation you will have for how common that low-grade normal staining is when you do look for and see it. And in doing so, you will better prepare yourself to differentiate situations of normal expected from those that are abnormal needing management. So how do you grade the extent and severity of staining and interpret its significance? The most commonly used grading scheme is some version of this global 4-step scale. Grade 0, of course, is no staining and ideal. Grade 1, trace staining, is not considered to be clinically significant and so requires no treatment. Grade 2 represents mild staining, and it, although also not considered to be clinically significant, is noteworthy and should be monitored over time. Grade 3 is moderate staining and would imply that therapeutic intervention is appropriate, while Grade 4 is severe, requiring treatment. And the evaluation of staining can be taken to another level by describing the type, the depth, and the extent of staining, and can yet be even further detailed by grading those dimensions individually in each of 5 corneal zones. When the corneal surface is considered in 5 zones, staining is described by a sector staining score or by some type of a cumulative staining score made up of 4-step graded findings from each zone. And what about lens care systems and corneal staining? Staining is found in association with virtually all lens care products, including peroxide-based systems. And the typical low-grade staining reported with multi-purpose solution use is virtually the same as that seen so commonly in non-lens wearing individuals. In fact, most studies of lens care products show that slit lamp findings, including corneal staining, remain averaged about baseline values, with a vast majority of all findings graded 0 or 1, no more than trace. Keep that in mind when seeing patients, and particularly when you are presented with studies that show statistical differences in the non-clinically significant range. Be aware of presentations that distort your perception. Here are a few examples. When staining data is presented on a magnified partial scale, the same results presented on the full 4-step scale now clearly show how the modified scaling had visually suggested significance where there was none, since all of the findings are below grade 1, less than trace amounts. Another perception spin occurs when an impression of significant difference is created without statistical support by simply stating that fewer incidents of staining occurred with lens care product A than lens care product B. While that is a true statement, it has no real practical significance. Another way to characterize staining is without grading, but simply as absent or present. However, in doing so, one spot of staining in each of 3 zones of the cornea could be noted as an incidence in 3 out of 5 zones, but reported as 60% staining. Few clinicians would agree that 3 spots of staining are equivalent to 60% staining. In this brief overview, I've encouraged you to provide the best care for your patients by looking for corneal staining, understanding that many factors can contribute to staining, recognizing that trace to mild amounts of corneal staining may be considered quite normal, and by being familiar with the grading scales, standards for acceptable levels of staining, and definitions of clinical significance. Be a good interpreter of staining data, remembering that the data can be defined, organized, analyzed, and presented in ways to spin impressions of significance that may or may not meet your criteria for clinical significance. And finally, if you look, you will see. And in understanding what you see and what it represents, you will be able to provide the best possible care for your patients. Extensive studies indicate Renew MultiPlus helps maintain healthy eyes for hydrogel and silicone hydrogel contact lens wearers. In a crossover clinical study, 78 patients wearing PureVision toric and SofLens 66 toric lenses used Renew MultiPlus daily in caring for their lenses. At the conclusion of the 1-month study, there were 0 incidents of grade 2 mild or higher corneal staining. In a 25 investigator 3-month clinical in which 450 contact lens wearers were randomly selected to use Renew MultiPlus, OptiFree Express, or Complete Moisture Plus solution, over 98% of all patients, regardless of the care product, exhibited no or traced staining. Slit lamp evaluations after 2 weeks, 1, 2, and 3 months of wear demonstrated that grade 2 or higher findings between lens care products were equivalent. Renew MultiPlus solution can be confidently recommended to hydrogel and silicone hydrogel patients for safe, effective lens care and comfortable lens wear.